This is Dr. Andrew Jones. In this week's edition of Veterinary Secrets, I'm going to be covering heat stroke in dogs, the signs that you can recognize if your dog or cat ever has heat stroke, and what you should be immediately doing and not be doing if your dog gets heat stroke. The normal body temperature of a dog ranges between 38 to 39 degrees Celsius, or 101 to 102.5 degrees Fahrenheit. Our pets maintain this temperature through panting, however, sometimes they're unable to lose enough heat. The most serious result is heat stroke. It's a very serious emergency, and it may even cause death. Dogs overheat much more quickly than we do. It's a big point you need to take into consideration. They can only cool down by sweating through their nose or foot pads and by panting. In the early stages of heat stroke, your pet will pant rapidly. They can have thick, ropey saliva and very bright red gums. In those early stages, their body temperature will be between 104 to 106 degrees Fahrenheit. As the body temperature climbs above 106 degrees Fahrenheit, your pet can go into shock with subsequent organ shutdowns. What's happening is the temperature's risen to such a big point that the body is just trying to preserve the most vital organ, such as the brain, and shut off blood supply to the other organs. And the big thing is preventing it from ever getting to this serious level. In that case, your dog will have very pale gums, weak, dizzy. They may even have vomiting and diarrhea. The brain becomes affected and they may even seizure or fall into a coma. And obviously in this case, it requires immediate life-saving veterinary intervention. Here's a picture of me checking my dog Lewis's gums to show you how you can check your own dog's gums. So what would you do first? Well, in the serious case of heat stroke or hyperthermia, you need to go to your veterinarian as soon as possible. If your pet's collapsed, you get them immediate veterinary care. And as I said earlier, in this case, the organs may be shutting down. They need specialized care. But while they're in transit, cool them as much as you can, applying cool wet towels to their groin, the back of the neck, and get them there as soon as possible. And obviously, get them out of the heat. Especially when we're looking at these moderate cases before it's become severe. Get your dog out of the hot car, away from the sun, moving to a shaded, cool place, and if you can, direct a fan on her. And then cool them down. You want to place cold packs, wet towels between the back of the legs, in the belly, and in the armpits. And then you want to apply some cool water to their ear flaps all along their paws. If you can, take their temperature. If we're suspecting heat stroke or early stages, use a rectal thermometer, find your dog's exact temperature. If it's 104 degrees Fahrenheit or higher, then they have heat stroke and they need to be treated appropriately. A big point you need to take home is not immersing your dog immediately in cold water. That's what most people think, just throw them in the lake or something really cold. But what can happen there, you can overcorrect their temperature. Secondary to, you can potentially also put your dog in shock by causing rapid vasoconstriction, where the vessels constrict on themselves, which is the last thing you want. So it's a controlled reduction in the body temperature. You can look at using rubbing alcohol. Rubbing alcohol can speed up heat loss. It can be applied to the belly, the groin, and it will cool as it evaporates. You can liberally spread it all throughout the skin. And as I said earlier, the biggest thing in reducing the temperature is doing it in a controlled way, and rubbing alcohol can help do this. Rehydrate. Obviously, let your dog drink as much cold water as he can. If you have an electrolyte replacement solution, something such as Gatorade, great. Go ahead and add it. Let him drink that as well, too. If he drinks too much, potentially he can vomit. But the big point, if they don't want to drink, don't force it onto them, but make sure it's obviously lots of cool, fresh water is offered. And as I alluded to earlier, you really want to be watching for shock. As with severe heat stroke, they're at risk for shock. So looking at your pet's gums, making sure they're not progressively pale. And if there's any question, they're going to the veterinarian as soon as possible. And if you're suspecting this, while you're trying to cool them down, applying those cool towels, you can also look at adding something like corn syrup or rubbing honey onto their gums while you're going to the veterinarian. There's some special cases you need to be aware of. There's certain breeds, the brachycephalic breeds, such as the pugs and bulldogs, You know, they snort a lot, but at times they can have difficulty breathing. And so because of that, they're at much higher risk of developing heat stroke. So just avoiding exercising them on lukewarm to warm sunny days, keeping them in the shade, and always being on the lookout for signs of heat stroke. And the last big point I want to leave with you, the big takeaway, just never leave your dog in a parked car. As you can see from this table here, within a very short period of time, if you've got an outside ambient temperature of 70, which is fairly moderate and fairly comfortable, in 10 minutes, that can rise, the interior temperature of the car can rise to 89 degrees Fahrenheit, which means rapid onset of heat stroke. So in a very short period of time, your dog can go from being comfortable at 70 to having clinical signs of heat stroke within as short as 10 minutes. So it's just never leaving your dog in a parked car.
Thank you for watching this edition of Veterinary Secrets. What I want you to do right now is click that link in the box below, and I'll be sending you my free books and videos on how to heal your pets at home with my top natural remedies.